Thank you very much for inviting me, and I'm pleased to be here today. I'm going to take you through a short talk about the HRT in evaluating optic disk progression. Now, this is what is known as the change probability map. So you need at least an area of superpixels that's 4 into 4 pixels to be able to identify any change. If the change occurs in an area smaller than that, then it's difficult. And you need an error probability that the machine gives you. And then the area of change, as you can see over here, okay, I'm sorry, it's not working too well, okay. If you can see this, the red zone shows that there is loss of rim and there is loss of retinal nerve fiber layer, and the green shows there is some elevation of this surface. So you do find elevation of the surface of the optic disc as well as of the retina, and then you have to figure out how to ignore that actually. So when you have red, that is significant depression. When you have green, that's significant elevation. So change is equal to local change in surface height measured in microns at the location actually. And you need about 10 microns that is validated to assume that this is progression. Okay, now the machine gives you these 3 photographs. The photograph on the left is absolute change. The photograph here shows statistically significant change. And the photograph here shows an infrared photograph with the red and green that shows statistically significant and reproducible change. ये एक और जरा दे दो ना, ये काम नहीं कर रहा है, कभी काम करता है कभी नहीं. And then you have the stereoparametric parameters. So the first parameter that you see here, that's G, temporal superior, temporal inferior, corresponds to this. When you get the G, that is global superior and inferior to the center, this thing, and then you get the global and you get the upper and lower. And then these points here tell you the time intervals when this test was done, and the graph starts from 0. So whatever is there, the first test starts from 0, and then it goes like this, and the lines that go down tell you that it's either the optic disc rim or the cup or the volume of the cup or the retinal nerve fiber layer that is either stable or that's going down. So this is a case study of a 47-year-old male. He was seen first in 2006, and he had an intraocular pressure of 18 millimeters of mercury. The CCT was 505 and 522. He was on Lumigan eye drops actually. Glaucoma surgery was done in 2011 and in 2013 for the left and right eye respectively, and the intraocular pressure presently is 11 millimeters of mercury, both eyes, using a beta blocker. And this is the change analysis that we find over 5 years actually. So you can see here, this is the last photograph here, and you can see the change analysis here. And then when you take a look at the color photographs, you'll find that there was a hemorrhage here, and then there was development of retinal nerve fiber layer defect, and then there was further loss and diffuse loss of retinal nerve fiber layer defect, so that the classical retinal defect that is available here is not seen so well in this photograph. And when you see the inferotemporal lines, then you see the blue line here, it goes down, that's the rim area, and likewise the blue line here, that is the retinal nerve fiber layer line, that also shows that it is going down actually. So that's what you can get over a period of 5 years. But we learned after looking at all these photographs, and even while preparing for this talk, that it's very, very important to have color photographs to judge what is happening. And sometimes you get fluctuations in long-term follow-up on the HRT, a little bit like what you see also in automated perimetry. And this is the cluster analysis, and you can see the red patches here, and you can see the change. The change is about 118 microns. So there is 118 microns depression of this patch of superpixels here, that shows that there is loss of retinal nerve fiber layer, because when the retinal nerve fiber layer is lost, the surface becomes depressed, and so you get a depression actually. And this is the left eye, and you can see what's happening here, that there is only some change that you can see here superiorly, but it's not really very significant. But what's really interesting is you go back and you feel that it's all quite normal and there's no significant change, and you take a look at the retinal nerve fiber layer, and you can see from here, you go here, you see a classical defect, and that classical defect here tends to have increased, and you can see increased tessellation and increased loss of height of the retinal surface actually. And then you go back to the stereoparametric parameters, and then you assess the retinal nerve fiber layer and the rim area and see whether this is correlating with that. So even when you have all these follow-up protocols, even then I think it's always a good idea to have a color photograph to assess what you're going to do actually. So you can see here that this just validates itself as a superpixel, but we would have thought from the color photographs that the difference would have been very significant, and you can see the healthy retinal nerve fiber layer on the infrared photograph here in the macular area, and you can see that this area, the retinal nerve fiber layer is not so well seen actually. And there is a change according to this follow-up of just 71 microns in depression actually. This is another case of a 51-year-old male who came to us in 2007, and we've been following him up. His axial length is about 26, 27 in both eyes, and he's been on betagan and travatan actually. He underwent cataract surgery on both eyes in 2015. Intraocular pressure now is 14 millimeters of mercury with using both alpha agonists and beta blockers. And this is the left eye. We have a 2.5-year follow-up, and you can see the significant loss that's taken place in this image here. The red area shows that. And of course these photographs are not so clear, but when we take a look at them magnified, then the superior rim is lost and there is development of retinal nerve fiber layer defect in this area over a period of 7 years that this patient was followed up actually. And this is the rim area for the global superior and inferior segments, and so the temporal superior segment is here in green. You can see that it's decreasing, and then you have the cup volume, which is also temporal superior. It's a green line, and that's not showing that much change, but there is some, the line is sort of going down. And this is a lady, a 63-year-old female, and her axial length was 23. She was phakic when she first came to us in 2003. Her intraocular pressure was 20 and 22. And then on follow-up, it was 20 millimeters of mercury with prostaglandins. Combined surgery was done in 2009. Intraocular pressure now is 16 millimeters of mercury with beta blockers actually. And this is the right eye, and it shows us that there is loss of the rim inferiorly actually. And we could see the loss of rim, and this photograph you can see that the disc appears to be pale, and that's not really so pale, but this is just to validate what Dr. Pandav already pointed out to you, that sometimes the flash and the photography, that's all very important in being able to assess the rim and the cup and the retinal nerve fiber layer, but there is loss of the inferior rim here, and you can see here that the rim area, inferior rim area, which is the blue line here, shows a significant dip actually. And that's the cluster analysis, and you can see that there is a change of 271 microns in the surface of the rim here, and you can only get such a depression of 270 microns on the rim of the optic disc, but you can't get so much depression in the retinal nerve fiber layer loss actually. Thank you all very much, and we very hope that all of you will join us for the Glaucoma Society of India meeting that's to be held in Palampur, and wish you all the best, Surinder.
Thank you, Vinay.